welcome to Community Pulse. We're so glad you're here today. We always have good information for you. And today we have some more of that, good information. We have with us Dr. M. Lalehzarian, and you are a urologist, and you are the chairman of Prostate Cancer Awareness of California. Thank you for being here today. It's good to have you.
Thank you for inviting me. Before we start, I would like to wish a healthy and a happy new year for all your viewers.
Thank you. Thank you. I'm sure that they appreciate that. Thank you very much. Have you had good holidays?
Yeah, it has been cold,
Yeah.
but yes, any holidays are new chapters in everybody's life, and hopefully everybody will make the best out of it.
That's right. That's right. Well, let's get down to business. You are a urologist.
Yes.
Why did you become a urologist, and what kind of medicine is urology?
Very good question, Linda. Urology is a combination of medicine and surgery.
Okay.
Urology deals with the plumbing system of the body.
Okay.
Kidneys, bladder, prostate, controlling your urine, and testicles, infertility, erectile dysfunction. Good part is we do not discriminate man or woman.
Okay.
OBGYN people,
Right.
they just see woman. We see man and woman, no problem.
Okay.
Next point is we do not discriminate age-wise. We can see kids since they're born till they're 100 years old.
Wow.
So combination of all these acting together, and there are times that we can help our patients with medication, and there are times that we can do surgery for the patients to help them out. So combination of all this makes urology more interesting from my point of view compared to the other specialties.
Absolutely. It certainly is. So you decided to become a urologist. And how long have you been a urologist?
I've been being a urologist for 24 years, and I had several years of training in England and at the University of Maryland and the University of Chicago here. Several years, but actively working in urology, seeing patients for 24 years now.
That's great. Your office now is in the High Desert Institute of Urology in Apple Valley, correct?
Correct.
That's great. That's great. So at the end of the program, we'll remind them where you're located, just in case they need an appointment. If that's okay
Be happy
with
if
you.
I can help anybody. If they have questions, they can call, and be happy to guide them and to talk to them.
Good, good. Now let's get to what I want to ask you. I would like to know, cancer, tell me what it is. What is that terrible monster that we're so afraid of?
Excellent question, Linda. Unfortunately, majority of our viewers do not know what cancer is.
Okay.
The only image that they have from cancer is a death sentence. They go back to several years ago when there was no treatment and technology was not this advanced. They remember uncles, grandpa, grandmas. Somebody got cancer and they had a bad death.
Right.
So at the back of their mind, cancer is a death sentence. Cancer is a disaster. Cancer is something that is going to make everybody's life up and down, which in reality, it is not true. Today, I'd like to talk a little more about cancer and tell them what cancer is. It's not frightening. It doesn't come from another planet to kill everybody and go back.
Mm-hmm.
All organs in our body are made of cells. These cells, they have their own organization. Each cell has a mechanism. They have expiration date. depending on what they do, they should die after they have done their job. For example, platelets, which are the small cells in the blood that they can call coagulation of the blood to prevent bleeding. Platelets, they live for 3 to 4 days. After 3 to 4 days, they're replaced with the new ones. They die. Red blood cells in the body, their job is for 120 days. So after 4 months, they die, and the new red blood cells replace them.
Okay.
So this is the cycle of all cells in the body. And it's very accurate, and it's done perfectly. Now, if for any reason there is a disturbance and problem in this expiration date, and it doesn't click the way it should be, and the cells that's supposed to die today, they don't die.
Right.
You can imagine if we are dealing with 1,000 cells, they're supposed to die, 1,000 new one coming in. If these 1,000, for any reason, they don't die, they stay there, another 1,000 new comes in, so we are dealing with 2,000 cells. You can imagine as it goes on, it will be 4,000 cells.
So it multiplies and
Multiplies, goes on and on and on, and these cells, they join together. This is where we feel a lump. Now this lump could be anywhere in the body. In female, could be in the breast. In man, in the prostate, in the liver, in the lung, wherever. So when these cells don't die and they get together, they create a lump or a tumor. This is cancer. Nothing extraordinary. Just the mechanism of turning the switch off
Right.
is malfunction, and they don't die the way they should be, and they start growing. Now, when they start growing, depending on when they are, where they are, or what functions they have, they might cause some disturbances. They might get out of their system, they go to the blood, and then they go somewhere else, to the bones, to the lungs, to the liver, and then they start multiplying there. This is what we call metastasis. So cancer is gone out of their boundary, and they've gone somewhere that they should not be going to.
Right.
Now, depending again which cells we are talking about, they can produce some products. Let's say if cancer is in the kidney, let's say.
Okay.
So it keeps getting bigger, and it can interfere with urine production. And it can cause some bleeding. Patients might get blood in their urine.
Right.
If it is in somebody's uterus getting big, it starts bleeding. So depending on where they are, how they are, these cancers, these tumors, somehow they show themselves. Now, the goal is we would like to get these cancers as early as possible. Now, depending on what kind of cancer we are talking about,
Right.
there are certain parts of the body that patients, they have access to. Women, they can touch their breast and examine it.
Feel a nodule, a lump.
Exactly. If they feel something abnormal, a lump or a nodule, as I told you, the cells getting together, they can go to their doctor and say, this wasn't here 2 months ago, what is this? So they can biopsy and take care of it and whatever it is. Certain parts of the body you do not have access to.
Right.
And prostate cancer, unfortunately, is one of those that men do not have access to examine their prostate. Therefore, it cannot be diagnosed unless they go to medical profession. They do the rectal exam,
Right.
and if there is any lumps or bumps or anything abnormal, they can pick it up.
And that's the only way a urologist like yourself can actually tell if there's a lump or a bump on the prostate is by doing the rectal exam.
Rectal exam it can be done by medical professions. The ones who are experienced, they've done rectal exams, they can pick up abnormalities when they do it. And in conjunction with the blood test PSA, prostate-specific antigen, which is a protein that is produced by prostate and goes to the blood. Combination of these two, if there is any abnormality, then it can raise the flag to go further to see what's going on. Now, I would like to mention again that as far as prostate cancer is concerned, in earlier stages, there is no symptoms. And my famous sentence, I like to repeat this, I like all our viewers to remember this sentence, that the most common symptom of prostate cancer is having no symptoms.
Very good.
Meaning all men who do not have any problem with the urinary system, it doesn't mean that they cannot have prostate cancer.
We will close for a minute, but when we return, I would like you to explain what are the things they need to look for, or what age should they be checked, the men, and possibly what tests they need to do, if that's okay with you.
I'll be happy.
All right, you will be right back. All right, Community Pulse, we'll be back in a minute. We have more information with this wonderful doctor, Dr. Lalehzarian. Thank you. We'll see you in a minute.
And then from this angle, it all makes a star.
I'm a teacher. Let me tell you what I make. I make learning a privilege, not a chore.
Show up
And frustration, a tool, not an obstacle. I make working hard seem easy, and giving up impossible.
And then we're going to turn on the lights and everybody look up.
I make an old subject feel like a fresh thought.
Finally won.
What's your reaction? Yeah, exactly.
And unconventional methods
Okay, what else?
common.
This is their world.
There's nothing.
And then they die. Go ahead, go, go, go.
I'm a teacher. I make more.
Hey, Hard, what's this?
That's my resignation letter.
You're resigning. Why?
Because you're constantly ignoring me. You're half as active as you used to be, and you get stuff like this.
You've been putting me under a lot of pressure lately.
That's why I'm ready to quit.
I forgot. I'll do better.
Please, don't quit on me. Okay, but remember, it's not what you say, it's what you do.
Listen to your heart. Don't let it quit on you.
Let's go for a walk.
Uncontrolled high blood pressure could lead to a stroke, heart attack, or death. Get yours to a healthy range before it's too late.
Ballerina.
Sometimes all it takes to be a dad is remembering how to be a kid again. Take time to be a dad today.
Body language. Without saying a word, it can tell you so much. Like someone is having a stroke. Know the sudden signs. Learn fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time. Time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery. Learn the body language, the sudden signs, and spot a stroke fast.
Welcome back, Community Pulse. I told you that was a really interesting conversation we had before the commercial. And we're back again with the wonderful Dr. Lalehzarian. Dr. Lalehzarian, tell me, let's touch a little bit on men's cancer, like prostate cancer. Women do not have a prostate.
True.
Okay. Men's prostate cancer issues. At what age? I know there's controversy as to when they should be tested for prostate cancer, but approximately when do you believe a man's supposed to be tested, and what are the tests for prostate cancer, doctor?
You're right. There is controversies depending which Academy of Physician or American Urological Association or the different sections thinking differently. But generally speaking, men after age 50, they should have their annual checkup as far as their prostate check is concerned and their blood test.
Okay.
Saying that, patients who have family history of prostate cancer, and especially Afro-American gentlemen,
okay,
because they are more susceptible to prostate cancer, recommendation is starting at age 40. So if they have uncle, grandpa, father, cousin having prostate cancer or brother, they should be more alert and start from age 40
right,
to be careful, to be checked. So if there's anything wrong, hopefully in earlier stages will be taken care of and they will be cured.
right, right. I knew a person, a gentleman, years ago, who had prostate cancer, and he had it more in the advanced stages. He was, however, offered a treatment, but he refused it. The reason he refused it was because he wanted to not lose his erections. Now, if there is treatment for prostate cancer, and we know there's a variety of treatments, if there is treatment, will all the men become have erectile dysfunction?
No, as you said, Erlinda, problem is majority of our patients, because of a bad history that they had, somehow they are living in the past. They had something in their mind, and it's not easy to take it out. And a lot of them do not have access to new development and new technologies. Some of my patients who have prostate problem, when you talk about surgery, they said, no, I don't want, surgery is the last thing. And I asked several of them, these are 50, 60, 65, why not? I said, well, I had a grandpa who had surgery for his prostate. He could not control his urine the rest of his life.
Oh.
And we didn't want to go and visit him because he was miserable. Oh. This is the last thing in my life I want to have it. So it is sad to see that happening because these days, with advancement in all these technologies, medications, different treatment for different problems, they can be cured, they can go back, even if they have cancer. There are techniques that they can save their nerves and they can keep their erection. There are techniques that they can do to help them to have a good control of their urine. Even if it is not possible and it happens, still there are ways that we can help them to get back to normal, to have their sexual activities, and to have a control of their urine back. So these ideas are not right, and it's sad to see some people, they think that way and they don't want to do it. Nowadays, people who have enlarged prostate and they have to get up several times at night, go into bathroom every half an hour. Sometimes they have to run to find a bathroom. It takes a long time to stand there. My patients, they tell me, I stand there, 2, 3 people, they come to the next urinal, come and go. I'm still standing there, still I am doing my job and what. they can have laser for their prostate as an outpatient. They go home the same day. 2-3 hours staying in the hospital for an hour surgery. They can go. Even patients who are on blood thinner, they can have laser, not stopping their blood thinners, which is a big deal. Patients who have valve replacement, people who have deep vein thrombosis, people who have heart stent, these people, or people who have heart palpitation or fibrillation, they have to be on medication to thin their blood.
Right.
And normally surgeons don't want to touch them because if they start bleeding, it's not going to be easy to control it.
Right.
So these patients have to come to hospital a couple of days in advance. They stop their medication, change them to heparin, change their medication, do the surgery. After that, again, turn them back to their original medication and what. So it is doable, but it takes time. It's time consuming. But now with this new advancement in laser, for example, they don't have to stop it. They go and have the surgery and go home.
Very good.
Now, they should not be worried about these complications, side effects, and this old stories of grandpa and uncle and whatever. They should not destroy the quality of life based on what grandpa did 80 years ago.
Right. And even so, though, as a woman, I would, if my partner had developed prostate cancer and he didn't want treatment, I'd drag him to the doctor and make sure that he got the treatment, because I'd rather have him alive than in a box.
True.
My friend, by the way, did die.
True. Unfortunately, some men, they're so afraid that they don't want to take initiative. And some of them, they don't even want to talk about it.
Yes.
They let it go that far to a point that there is not much to be done.
Right.
But I think if they are educated and their partners, if they are educated, just let's open the box in front of them. The whole idea is to help them to have a better quality of life.
Absolutely.
Why should you live with a fear of dying because of cancer and having miserable life, getting infection? And assure you, prostate cancer, if it's not treated right, they will have problem controlling their urine at the end, and bleeding and infection, and all these problems will come, unfortunately, at the time that there is not much to be done. So the sooner they get into it, the more benefit they are going to have.
That's good to know. So we are happy to learn that there are treatment options, and if the treatment option should have a side effect, there are treatments for that as well.
Exactly. For example, people, if they have surgery and they have problem with their erection, there are penile prosthesis, different types.
Right.
They can be inserted so they can continue their sexual activities, no problem. If they have problem controlling urine, we can insert sphincters and they have a full control and be dry. They don't need to be on a diaper. They get back to their normal activities. And all these are doable and all these are possible. And I don't see any reason for these patients, why should they suffer themselves and their partners for whatever life that they're supposed to enjoy.
Right. So let's enjoy life.
That's the point.
Yeah, just stay on top of it. Keep an eye on your health, on your total self. Now, very quickly before we close, I did want to ask you one more question. Nutrition, diet. Everybody wants to know, is there something I should not be eating or something I should be eating? But I've heard that heart healthy is the best diet for cancer.
You hit it right. You're right. Just to sum, if you go through different newspapers and different research ideas, you might get a little confused with different articles coming out. This is not good, this is good, this is better. But the bottom line is, whatever is good for your heart is good for your health and your prostate.
Very good.
Meaning, don't have fatty foods, don't overuse alcohol, don't smoke, have decent exercise, and watch what you're eating, and help your health. Not a big deal.
Yeah. So
If
that
you help
can-
yourself, your
you'll
health
live-
will be better.
and
you
you'll live
enjoy
longer,
your life
probably.
better. That's it.
Yeah, that's really good.
Unfortunately, I see some of patients that I tell them don't smoke anymore. They say, if I don't smoke, I'm going to die.
Oh.
Well, I don't know which one is going to kill you first, the smoking or not the smoking.
Now, before we close, Doctor, I'd like you to please leave our viewers with a thought.
I hope I could open a new window for our viewers today, taking the fear of cancer out of your brain. And hopefully, you're not going to be worried about this cancer. I hope what I did today, I changed big C to a small c. So the fear from there should go down to there. And I hope nobody gets it, but even if you get it, it's not the end of the world. There are so many things can be done. Now that you know the mechanism, so knowledge is power. You have the power in your hand, so enjoy your life and whatever is left.
Very good. Thank you so much for being here today.
It's a
We
pleasure.
really appreciate it, and we look forward to working with you in the future. And the people in Apple Valley are probably very happy that you're out there.
Thank you very much. I wish all the best for all our viewers, and hopefully you change your mind about these kind of problems from today in 2015.
Yes, yes, 2015. Where did the time go, Doctor?
It goes so fast. You see, I'm still in 19 instead of 2000.
It just flew right by me. Well, thank you again. We thank you.
Have a good
All
one.
right, the City of Rialto. This was Dr. Lalehzarian, and this special was just for you, to educate you and give you information so that you may live life just a little bit better. Again, this is Erlinda Patterson, and this is your television program, Community Pulse. Thank you, Doctor.